explanation and wonderful review of the guidelines. So coders, you all did a great job on those scenarios. So it's time for me to take you to the next guidelines on the neoplasm. And this one is about the encounter and admission involving radiation therapy, chemotherapy, immunotherapy, brachytherapy with or without complications. So the guidelines which we are going to review here, C2E2, it states that encounter solely for the administration of chemotherapy, immunotherapy, external beam, radiation therapy, code for the reason for encounter. So if the patient is coming for anti-neoplastic radiation therapy, you have to assign Z51.0 as the primary code. And if the patient is coming for an anti-neoplastic chemotherapy, first code assigned will be Z51.11, and for anti-neoplastic immunotherapy, the first assigned code would be Z51.12. So if the patient receives more than one of these therapy during the same admission, more than one of these codes may be assigned in any sequence. And the malignancy for which the therapy is being administered should be assigned as a secondary diagnosis. So next, encounter solely for the insertion or implantation of brachytherapy, code the reason for encounter. So if the patient admission or encounter is solely for the insertion or implantation of the radioactive elements such as brachytherapy, appropriate code for the malignancy is sequenced as a principal or first listed diagnosis, and you have to note that code Z51.0 should not be assigned. Next one is on C2E3, guideline C2E3, encounter for administration of chemotherapy, immunotherapy, external beam, radiation therapy, which developed a complication. So once again, code for the reason for encounter. So if the patient is coming for an anti-neoplastic radiation therapy and the patient develops any complication, first assign Z51.0, and second, the complication. The same applies for the anti-neoplastic chemotherapy, where we should first assign Z51.11 and second, the complication code. And for anti-neoplastic immunotherapy as well, the first principal code would be Z51.12 and second would be the code for the complications. So moving on, for insertion, if the encounter is for insertion or implantation of brachytherapy, which after which the patient develops a complication, code the reason for encounter. So when a patient is admitted for the purpose of insertion or implantation of radioactive elements and develops some complications such as an uncontrolled nausea and vomiting or maybe dehydration, the principal or first listed diagnosis is appropriate code for the malignancy and followed by, the principal code should be for the malignancy and followed by the codes for the complication. So this is the sequencing order. Next, I think it's time to do some ICD-10 flip challenge. So coders, are you ready? Let's do it. Yes. And here's your question. What is the correct ICD-10-CM codes for this encounter? Your options are option A, Z51.0, C71.2, option B, C71.2, Z51.0, option C, Z51.1, C71.2, option D, C71.2, Z51.11. Olivia, a 45-year-old female with a cancer of temporal lobe, arrives at the radiation treatment facility for her second series of radiation treatment. What is the ICD-10-CM codes assigned for this encounter? So coders, you got 2 minutes to solve the scenario. See you after that. Phenomenal job, coders. I see most of you have got it correct. And for the others, it is going to be a teachable moment. So the keywords: a 45-year-old female, the cancer of temporal lobe, arrives at the radiation treatment facility, and for what? Patient is here for the radiation treatment. So coders, I've got a question for you. Which guidelines did you apply here or refer here to get this answer? Place your answers in the chat. Because using the guideline, I can eliminate few options here on site. Yes. Yes, the guidelines referred here is C2, E2, which is for encounter solely for the administration of chemotherapy, immunotherapy, external beam radiation therapy, which states that if the patient hears here for the encounter is for the radiation therapy, sequence first Z51. And in our scenario, the patient came for the radiation treatment, as you can see highlighted in the question. So we are going to assign Z51.0 as the primary TX. So keeping that in mind, I can eliminate option B and option D on side because they are having a wrong sequencing order. On site I could have eliminated. So knowing these guidelines, this is the advantage which I'm going to have while going to attend the exam. So I've eliminated option B and D on site, and remaining options is A and C. Let's look what Z51.11. Z51.11 is coding for anti-neoplastic chemotherapy encounter. It's for encounter for anti-neoplastic chemotherapy. Did the patient came for an chemotherapy? No, the patient came for a radiation treatment. So I can eliminate option C as well. So without looking into the ICD book, I could have picked option A, Z51.0, C71.2 as my correct answer. So that is a strength of having good knowledge on the guidelines, coders. So how are you feeling? How are you feeling? Yes. So if you need any clarification, please place your questions in the chat. We will be happy to address them. So let's move on to the next scenario. Oh, next we are having few guidelines review as well. So next we will be reviewing on the sequencing of neoplasm codes, and yes, the guideline C2I3, which is for malignant neoplasm in pregnant patient. So when a pregnant patient has a malignant neoplasm, a code from subcategory 09A.1, which is malignant neoplasm complicating pregnancy, childbirth, and puerperium should be sequenced first, followed by appropriate code for chapter 2 to indicate the type of neoplasm. So that's the guideline. As you all have, all you know, that chapter 15 has got a sequencing priority over other chapters. So let's move on to the next one. Personal history of cancer, the guideline C2M. It says that when a primary malignancy has been previously excised or eradicated from its site, and there is no further treatment directed to that site, and there is no evidence of any existing primary malignancy at that site, a code from category Z85, which is a personal history of malignant neoplasm, should be used to indicate the former site of malignancy. And if the patient is having a secondary cancer, that can be assigned as a secondary code. So that's the guideline C2.M. And the other one, if the treatment was directed at the secondary cancer and the primary cancer is resolved, your sequencing order would be code first the secondary cancer and code second Z85, which is a personal history of malignancy code. And malignant neoplasm associated with transplanted organ. The guideline C2.R. So a malignant neoplasm of a transplanted organ should be coded as a transplant complication. So the sequencing order would be like this. Assign first the appropriate code for from the category T86, which is a complication of transplanted organ and tissue, followed by code C80.2, which is a code for malignant neoplasm associated with transplanted organ. And next, use additional code for specific malignancy. So this is the sequencing order for malignant neoplasm associated with transplanted organs. So we have covered all those sequencing guidelines on malignant neoplasm, and let's do some exercise on that. So here's a question for you, coders. Is the code? What is the correct ICD-10-CM code for this encounter? Your options are option A T86.13, C80.2, C64.9, option B C80.2, C64.9, option C T86.11, C64.9, option D T86.11, C80.2, and C64.9. Mr. Smith, a 55-year-old male who underwent kidney transplant 5 years ago, he has been doing well since the transplant but recently started to experience fatigue and pain in his back. He went to see his doctor, who ordered a CT scan. The CT scan showed mass in Mr. Smith's transplanted kidney. A biopsy of the mass confirmed that it was a malignant neoplasm. Mr. Smith is scheduled to start the chemotherapy next week. He is hopeful that chemotherapy will be successful and that he will be able to keep his transplanted kidney. So coders, you got 2 minutes to solve the scenario. See you after 2 minutes. All the best. Excellent work, coders. I've seen someone facing the chat. The guidelines which they have used. Yes. Once again, using the guidelines, I think you can solve this scenario easily. So the keywords for this one: patient underwent A kidney transplant recently started to experience fatigue and pain in his back. Mass in Mr. Smith, a transplanted kidney was diagnosed, and it was diagnosed to be a malignant neoplasm. Patient will start the chemotherapy as well. So just in the previous slide, we discussed the guideline on neoplasm associated with the transplanted organ, and the guideline was C2.R, which stated that the sequencing order for a patient with malignant neoplasm associated with the transplanted organ. So this is a sequencing order. First, we would assign a T86, which is a complication code, followed by C80.2, and third would be specific code for the malignancy. So the patient in our scenario also has a malignant neoplasm in the transplanted organ, in the kidney. So keeping this sequencing order in my mind, keeping this guideline in my mind, I could have eliminated option B because it's not following the sequencing order. The first code should have been T86. Option B is coding for C80.2. I could have easily eliminated this. I could have also eliminated option C as well because it is missing the code for C80.2, which should have been the secondary code. That leaves us with option A and D. Now let's look what option A is coding for, T86.13, which is the code for kidney transplant infection. And looking back to our scenario, the patient didn't have any kidney transplant infection. The patient had a kidney transplant rejection actually. So I can eliminate option A as well, and the correct answer is going to be option D, T86.11, which is the code for kidney transplant rejection, followed by C80.2, that is for malignant neoplasm associated with transplant organ. And you can see the instructional guideline as well. Code first the complication of the transplanted organ and use additional code to identify the specific malignancy. So the third code would be for the malignancy, that is malignant neoplasm of unspecified kidney except renal pelvis. The code would be C64.9. So how are you feeling about that one, Curtis? Once again, this scenario also gives emphasis on knowing the guidelines well. See, it got easy if you know the guidelines. So let's move on to the next scenario. Here we go. What is the correct ICD-10-CM codes for this encounter? Your options are option A, C50.91909 A.111, Z3A00. Option B, 09A.111, C50.919, Z3A.00. Option C, 09A.111, C50.929, Z3A.00. Option D, 09A.111, C50.911, and Z3A.00. A 32-year-old female is diagnosed with breast cancer in her first trimester of pregnancy. She is referred to a medical oncologist and maternal fetal medicine specialist. The oncologist recommends that she start chemotherapy immediately. Maternal fetal medicine specialist recommends that she continue her pregnancy. The woman decides to continue her pregnancy and undergo chemotherapy from next month. So, Cora, see you after 2 minutes. All the best for this scenario. That is 2 minutes, and from what I see in the chat, everyone has got this one correct. So let's go and solve this one together. 32-year-old woman, breast cancer in her first trimester of pregnancy, and she is here. She is going to continue her pregnancy. So let's look the guidelines. The guideline C2I3 is the one which we are going to refer, which states that sequencing of neoplasm. So when a pregnant woman has a malignant neoplasm, a code from subcategory O9A1 should be assigned first, followed by the code for the malignancy. Once again, with the help of this guideline, I can eliminate option A because of wrong sequencing order. Now let's look into the next code. All the three B, C, and D option have the code 09A.111, which is the code for malignant neoplasm complicating pregnancy first trimester. Yes, the patient is pregnant and she is pregnant in her first trimester. So we would assign 09A.111. Now let's look into the next one, C50.911, which is the code present in option D, which is coding for malignant neoplasm of unspecified site of right female breast. So specificity is wrong here. The doctor haven't specified in our scenario whether it's a left breast or it's a right breast where the patient is having cancer. So the code C50.911 specifically says that patient is having malignant neoplasm in her right breast. So this is incorrect because of the laterality. And let's look into the next C50.929, which is present in option C, which is coding for malignant neoplasm of unspecified site of unspecified male breast. Now, this is a pregnant patient, and we all know that this is incorrect because it is a woman, and the C50.929 is coding for malignant neoplasm of unspecified site of unspecified male breast. So option C is also incorrect. That leaves us with option B, which codes for 09.A111, C50.919, which is for malignant neoplasm of unspecified site of unspecified female breast, and a code for Z3A.00, which is for week of gestation, which is not mentioned over here. So how are you feeling, coders? Yes. So give me a moment. And second, coders, I'll be back. Yes. So shall we move on to the next question? I see you guys are rocking in the chat. Let's do this. Yes, let's move on to the next one. And here's your question for you. Mr. Joseph, what is the correct ICD-10-CM code for this encounter? Your options are option A is at 85.46, C79.51, option B is at 51.11, C79.51, option C, C41.9, Z85.46, option D, C79.51, Z85.46. Question of Mr. Joseph, a 56-year-old male patient with a history of prostate cancer that has been eradicated and is now presenting with the symptoms indicative of bone pain and discomfort. The patient underwent a radical prostatectomy a year ago. After undergoing various medical tests, he has been diagnosed with bone metastasis, and Mr. Joseph will start his chemotherapy in coming weeks. So, coders, once again, see you after 2 minutes. All the best. Phenomenal work, coders. Once again, great work in the chat. So let's solve this one together, highlighting the keywords history of prostate cancer, and that has been eradicated. Now presenting with the symptoms of wound pain and discomfort. The patient had underwent a radical prostatectomy 1 year ago, and now he has been diagnosed with metastasis of bone, and he will start his chemotherapy in the coming week. So the guideline which we are going to refer here is C2M, C2.M, which states that if the treatment is directed towards a secondary cancer and the primary cancer is resolved, assign first the secondary cancer and second the personal history code. So it was clearly mentioned in our scenario that the patient had a prostate cancer initially and it has been completely eradicated. And now the patient is coming with a bone pain and discomfort, which was diagnosed as a metastatic bone cancer. So it's clear from the documentation that the primary cancer is completely resolved. So with that in mind, I can eliminate option A once again for a wrong sequencing order. Option B is also wrong because of the sequencing order. That leaves us with option C and D. Option C, what is that coding for? That's coding for a malignant neoplasm of bone and articular cartilage unspecified. Now this is also incorrect. Why? Because this is coding for a primary cancer and we had a metastasis of a bone cancer, right? So option C is also incorrect and the correct answer is going to be option D, C79.51, which is the code for secondary malignant neoplasm of the bone, and Z85.46, which is coding for a personal history of malignant neoplasm of the prostate. So option D is the correct answer. So how are you all doing? I see most of you have got this one correct. So great work, coders. You are very strong in your guidelines. So that's all from me. I think it's Miss J coming up next. So great work, coders. And Miss J will take you over from here.
Thank you. Thank you so much. So I would normally say, Mr. Sandeep, close it on out, but I want to know, how is my sound? Let me know. Go ahead, type in the chat. I'm not going to show my screen yet, but I want to see what you're saying. Am I still going in and out, in and out? I hate to say this, it may be my computer. Well, thank you so much, Mr. Sandeep, for helping me out here. And thank you, coders, for your patience. Thank you, team. And I just want to say this. I think we're gonna leave early today. Yes, a lot earlier today. So if you didn't get that homework done, you can. Okay? You can. Wow, I didn't realize. All right, coders. Great job. You did amazing. Thank you all. You all, you know how we encourage you all? You encourage me. You know, some of you were like, you got this, Mrs. J, rooting for me in my sound. You are amazing, and I thank you for it. Now, I do want to tell you this. Embrace the challenges ahead with confidence and enthusiasm, knowing that you're on the path to excellence. You've come this far, and there's no stopping you now. This one's for you. I give you all 5 stars. I saw light bulbs go off. I saw my team delivering it, and I saw my the intern staff, the instructional staff. You all are amazing. but coders, you are too. Please let us know how this class was for you. Um, I do read your emails. I do. I try to respond. So if you got a response from me last week, you're going to get one this week. I do my very best. All right. So thank you all for a wonderful class. And I want you to have an amazing, okay, I want to go back. I want you all to have an amazing day. All right, coders.
4,000 exam passers and free classes at AMCI. Learn to code straight from home or on the road at AMCI. We're on the East Coast, the West Coast. We're all around the world. AMCI. 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 4,000 exam passers and free classes at AMCI. Learn to code straight from home or on the road at AMCI. We're on the East Coast, the West Coast. We're all around the world. AMCI. 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 AMCI.
Thanks for tuning in, and until next time, happy coding!